Today I'm joined by Dr Emily Stockings, who's a Senior Research Fellow at the University of Sydney. Now, Emily's research primarily focuses on vaping, particularly in young people. In my GP practice, I see many patients that have taken up vaping as a way to quit smoking, but the rise in vaping within young people is especially alarming, especially when we don't know the risks, and also there's so much confusion around the laws and regulations in Australia. So what are the key differences between vaping and smoking? Is it even legal in Australia? And what chemicals are you actually inhaling when you vape? Why has it become so popular with young people? And what can you do if your teenager has become addicted to vaping? I'm really excited to share this one with you. Let's get into it. So Emily, welcome to the podcast. Thank you for joining me today.
Thank you so much for having me, Shauna.
So tell me, how did you become interested in this area of research?
I have a background in psychology, so that's what I studied at uni, and then I did my PhD, and at the time it was in smoking cessation, so helping people who are very heavy smokers to quit smoking. At the time, this was a long time ago, it was around 2006, 2007, we had a few people asking us, have you heard of electronic cigarettes? And I was like, no, not really. That's not really a thing. Fast forward to 2023, 2024, and it has exploded. So in that, I've been in the area of tobacco control for a little while, but I've just been fascinated by the rapid increase over time. And when they were introduced into the market, the whole idea was to help people quit smoking, and that hasn't played out. So I guess that kind of got me interested to understand why these products are so available and why they're in the hands of young people when that's not the intention from the outset.
So just to confirm, what is called in Australia vapes or vaping is the same as e-cigarettes, is that right? It's just that the iteration has moved and you no longer have to plug them in to charge them or something, is that right?
That's it. So back in the day, when they first came onto the market, they were pretty clunky, big devices. So when we say e-cigarettes or electronic cigarettes or vapes, they're all the same thing. I think just the parlance has changed over time. So back in the day when they were first introduced into the market, they were what we call cigar-likes. So they were pretty big devices that resembled a cigarette. And yeah, you had to plug them in. The battery didn't last very long. The whole kind of concept of them being electronic was a bit more in focus. And as it's become more popular and the devices become much more sophisticated, they're a lot smaller, the batteries last longer. You don't really need to worry about the batteries so much. It's just been much more common to refer to them as vapes. So when we talk about e-cigarettes, we're talking about vapes. Same.
And so obviously we have listeners all around the world, but a lot of our listeners are Australian and people know this is where we're based. Where I live on the Central Coast, there has been an explosion of shops just popping up everywhere. It seemed like for about 20 years or so there, shops selling cigarettes had become less and less common. It was less and less common to see people smoking. And yet here we are. And I have to admit, I've been shocked by how many little shops are popping up. I'm completely confused, and I'm a doctor and a GP. I'm so confused as to what the rules and regulations are. Are they even legal?
This is my area and I get confused. So I'm totally there with you. And so for people who are not actively researching this and whose jobs might be completely different, like we're doctors, we're working in the field of, health. If that's not your field, you would be baffled by this. So it's kind of a bit of a long and kind of confusing story. Again, what you're seeing here, this proliferation of shops that are selling vapes, that is in line with the underlying population use of vapes. So let's go back a little bit. The e-cigarettes or vapes were first introduced into Australia in sort of like the mid-2000s. Well, they kind of started in China around that time. It took us all the way down here, probably until around 2013, 2014, before they started becoming a device that you'd see in people using them. And back then it was sort of like really interested people who'd heard about these in other countries actively importing them. Then a market started to develop. Some of your listeners may have heard the podcast around Juul, and what that meant for the tobacco industry. So in the US, this company identified e-cigarettes as potential consumer product that would be interesting, that would be desirable for young people to use. And they became marketed as Juul. This was like the first iteration of these attractive looking devices. They had beautiful colors. They were very slimline. And that's when the youth use started to take off. These were suddenly designed not just for smokers to quit, but they were another kind of like delivery of a drug that would be appealing to young people. So what happened in Australia was more around 2019, really, that vapes started to become imported on a regular basis, predominantly from China into the Australian market. And back then, we didn't really have any regulation around them. For a long time, we kind of sat on our laurels in Australia going, oh, the US, the UK, they've got problems. We're fine. It's not going to happen here. We're an island nation. We can control our borders. And we were pretty much caught by surprise. So back then, the regulation was such that anyone over 18 was allowed to purchase a vape in a bricks and mortar shop, so a shop on the high street, so long as it didn't contain nicotine. Good in theory, right? So you can, if you want to go and vape non-nicotine raspberry ice crush, you can go and do that. So you could legally go and walk into a store and say, hey, do you have anything that suits my flavor preferences? And they go, yes, we can mix it for you, whatever. It became very difficult, as you could understand, to try to distinguish between what had nicotine in it and what didn't. So under this regulation, the vapes that had no nicotine were all good. If you're over 18, you could purchase these totally fine. So that's when these shops started to appear because they could legitimately sell them. And people saw, entrepreneurial people, fair enough, saw a legitimate business there. They could import them, they could on-sell them, they could sort of like curate an experience in store where you could do different flavors, etc. So the non-nicotine, all good. Nicotine was at that point prescription only. We can talk about the new regulations as well. So if you wanted to vape nicotine, you needed to hold a valid prescription from a GP like yourself to show that you've tried all these other things, you've tried nicotine patches, you've tried gum, whatever. Your GP has had a conversation with you to say you should try nicotine. So you could then import under the Therapeutic Goods Administration, or the TGA's personal importation scheme, you could then import your own nicotine-containing vapes, and that was fine. The problem was we had no way of determining the difference between the nicotine ones and the non-nicotine ones. They look the same, they smell the same, they taste the same. The only difference was that the labels for the nicotine ones would typically have a warning to say this product contains nicotine. So then the regulations in Australia was sort of like, okay, anything containing nicotine is absolutely banned. You can't buy that in stores. You can't import it unless you've got a prescription. So the producers, predominantly in China, what they did was, to get around this, was that they just took nicotine off all the labels. So then we just had all these vapes coming into Australia that just had a flavour on the front, and we had no way of telling if they were nicotine or not. And this is really the peak of use at around sort of like 2019 to now, 2024. That's where we saw rates of lifetime use basically go from near zero among adolescents to up to a third of people in this very short period of time. And for current users, so people saying that they use at least monthly, going from, again, close to zero, it was around 1%, up to around 10% because of young adolescents. So this was one of the main problems that happened. So then the Australian government and Border Force said, look, we need a better way of doing this. We cannot check every single package that's coming into the country. In order to tell if they're nicotine or not, you've got to firstly find the package among the millions that are delivered every day, identify which ones are vapes, open them up, have a look at them, and then test the actual chemical composition of those vapes to see if they had nicotine or not. It was just not going to happen. So they just kept going through under the assumption that they were non-nicotine. So the first round of kind of like crackdowns on this loophole came in January of this year, where Minister Butler, our Minister for Health, said any disposable vape, doesn't matter what's in it, any disposable vape is banned for importation, for manufacture, for domestic supply. And then in July of this year, we had the more kind of nuanced legislations come through to say that any vape that is not therapeutic, that is designed to help you quit smoking, any other vape is banned, and you have to go through your GP. We're currently in this funny little middle period between July and October of this year where that prescription requirement is going to be scrapped. So from the 1st of October this year, the prescription requirement will be scrapped. So anyone over the age of 18 who wants to use a therapeutic vape can access them through a participating pharmacy. So this is a whole heap of background that might be very confusing. Short version is any vape that is not designed to help you quit smoking and that is not accessed through a pharmacy is an illegal vape, basically. It's banned. That's the short version.
Wow. So, but yet there's still all these shops appearing?
Yet there are still all these shops appearing. Such a good point. So the other major factor that comes into this is we need people on the ground to check, right? So laws are great on paper. The reality, and your listeners know because you see this. I was at the bus stop just around the corner. I'm working at the University of Sydney, just around the corner waiting at the bus stop, and there's a packet of a vape that clearly has nicotine in it, just sitting on the top of the bin. So it wasn't even sort of put into the bin, and clearly it had recently been purchased nearby. So it's still happening. What kind of the Department of Health relies on is people enforcing it. So people either in the community who identify and report that a shop is selling vapes or they suspect that's the case. In New South Wales, you can report that to New South Wales Health. It's sort of like a web form you can fill out. But then that is dependent on someone coming and checking, right? What we're lacking here is people power. There is just so many shops. There is so much supply on the ground already because we've got so many imports still in the country that there just aren't enough compliance and enforcement officers, that it's still happening. I was in the Hunter Valley a few weekends ago, and on the counter, very visibly, and this is after the regulations changed where you couldn't sell them in shops. They were still there, complete plain sight. So I think there just isn't as much enforcement as what there should be or what there could be. And also shop owners are, I don't know, they might feel pretty complacent that they're not likely to get checked. And so the profits that they get from these products is well worth the risk of potentially being caught. So it's still very much happening.
Well, I want to sort of chat about a couple of things that you've talked about there. So I suppose the first thing is to clarify, I suppose what we're saying is that the reason why I suppose manufacturers overseas wanted to have nicotine containing vapes come into the country is because it's the nicotine that makes it so addictive. Because I have to say, like, I've frequently got mums and dads bringing kids 15, 16 in, and the kids will literally tell you that they're completely addicted to it. They can't stop. They're having to leave class to sneak off to the bathroom to vape. So just to clarify that it is the nicotine that's the really addictive bit. But I have to say, as a doctor, the other side of it is, to me, whenever I hear people telling me, oh, I love mango flavor, or I love this, I'm kind of thinking you're not meant to have food products or flavors in your lung. That's my, really basic understanding. So for example, if you were to choke on a small piece of mango and a little piece of mango went into your lung, you would actually get really, really sick. You would get an aspiration pneumonia and probably end up in hospital quite unwell. So it is kind of bizarre that, at some point it was still considered okay to be inhaling these flavors into our lungs. Do we know if that's okay?
Such a good point. And a few things to unpack there. I guess the first where I would start is understanding what's inside a vape, right? So the inside any vape, whether it is a pod device, which is the ones that you kind of attach a little pod to, or if it's a disposable or a refillable, they have to have a tank inside them. The tank is filled with what we call e-liquid, or commonly known as vape juice. Vape juice has four main ingredients. The first is propylene glycol, or glycerin. This is just a carrier liquid, so it is there for other things to be absorbed into it. The other main things are Glycerin has the same effect. It's a carrier liquid. Nicotine and flavorings. So these are the four main constituents of e-liquid. What happens is a metal coil, which is kind of suspended in the liquid, heats it up to around 200 to 300 degrees Celsius. The liquid then aerosolizes or turns into a vapor, and that's what you inhale. So yes, nicotine is the addictive component, and yes, you are literally inhaling chemical compounds or molecules of flavorings, also molecules of propylene glycol. So these very small molecules are similar to if you're spraying dry shampoo and you see that stuff, you spraying it in your hair, which is what I do because I'm a mum of 3 kids and I don't have time to wash my hair. I use it a lot. These are very, very small particles that contain physical components within them. So when you inhale them, they do sit in your lungs. We know that propylene glycol, glycerin are otherwise really widely used in things like cosmetics and food. But that's typically for a topical application or ingestion. It is not for aspiration. It is not for going into your lungs. Our lungs, as you know, are very delicate structures. Anything that goes in there that's a little bit too large is going to embed into the tissue. And then your lungs are going to initiate a response that tries to get rid of it. So what we do see in vapors is basically inflammation of the respiratory tract and the lung tissue. So it's in a similar way that you would get for things like bushfire smoke. There are microscopic particles that are sitting in there that your lungs are trying to get rid of. So when we do imaging of young people's lungs who vapes, we see these pneumonia type, for want of a better word, globs. So kind of like a collection of tissue where you can see there's an inflammation response occurring. These flavors are not meant to be in our lungs. They might be safe for other uses, such as in makeup or skincare or in foods and flavorings, but not when you inhale them. So that is something that is really important to remember for parents and for anyone who's vaping. There's some really good data coming out of the US, the Population Assessment of Tobacco Health Study, the PATH study, that's looked at bronchitis symptoms among young people who vape and the risk of chronic bronchitis. So this is cough, extra phlegm production, signs of inflammation in your lungs is 2 to 3 times higher among e-cigarette users. There was a recent article that was in The Guardian the other day demonstrating that the inhalation of vapes for different reasons to cigarette smoking can be as damaging. So there's a lot of chemicals in vapes that aren't in cigarettes. There's a lot of chemicals in cigarettes that aren't in vapes, but both can have really damaging impacts on our lungs.
And I know that we're early in the piece, but you would have to be suspicious that vaping is going to end up causing COPD or chronic obstructive pulmonary disease a bit like smoking does. If you've got this chronic inflammation in your chest, it would seem that that's the route we're going to go down. It sort of feels so frustrating because I feel like for years we've done so well, and smoking rates, obviously this is your area of expertise, but like what have they gone from and to? It seems like smoking is just not cool and it doesn't really happen very much anymore at all. And now we've seen this take off. It's pretty disheartening as a doctor. You're like, no.
Exactly. And my PhD was in tobacco control, and Australia has done incredibly well in controlling tobacco rates over the past 30 years. So in the 90s, it was still very common for young people to smoke. So 18 to 24-year-olds, I think the rates were around 30% who'd said they'd ever smoked a cigarette. These days, it is so low, it's almost non-existent that young people smoke. We still do have percentage hovering around the sort of 2 to 5%, depending on the group that you're looking at. So it's almost gone, right? We were in a position where we had done so well with our public health campaigns, with our tobacco tax increases, plain packaging, removal of advertising, that it kind of removed smoking as a behavior that was normal. The Smoke Free Tobacco Act also had a huge impact So this was the legislation that came in that said you can't smoke in buildings, in cars, in public places, on public transport, or within certain distance from buildings, right? So that had a huge impact on the public's acceptability of smoking. It became something that was just not done, right? So we got to this point, and we were doing so well, and we were lauding our success in tobacco control. And then along came vapes, and it's kind of undone that. At the start, a lot of the proponents or supporters of e-cigarettes to help people quit smoking said it's actually not making young people start smoking, it's just diverting them away from cigarettes. So let me unpack that. A young person who might have in their life become a smoker, instead of becoming a smoker, they have become an e-cigarette user. And that is what they have continued on using in their lifetime. So that we've diverted them away from the potential trajectory of being a smoker. That was the initial thinking. So back in 2013, when e-cigarettes were first measured at a population level in Australia, most of the use of vapes was among existing smokers. So everyone was sort of like, this is kind of a good thing, right? So instead of them smoking conventional combustible cigarettes, which are incredibly harmful and still kill 7 million people worldwide, they're diverting towards e-cigarettes. Unfortunately, what's happened over time is that the number of young people who would never have smoked a cigarette or would never have used a tobacco product are picking up these devices. We're seeing higher rates of ever vaping than we did smoking, in the 90s. So it is not just the people who otherwise would have smoked who are picking up these products. These are kids who, without these products on the market, they might never have gone near them. So that's the thing that's really disheartening. And then there's the additional risk of young people then using vapes and transitioning to regular tobacco cigarettes. So that's something that the government have been really concerned about. These products are not only enticing a population of young people who would never otherwise have used vapes, but they're then transferring them onto big tobacco products, which are cigarettes, which are, still the leading cause of death in Australia. This is still unfolding. We don't know yet if that is the case. There's a lot of good evidence indicating that young people who do vape are 2 to 3 times more likely to then smoke. So it is looking in that direction. Whether that is because young people who pick up a vape have higher risk factors, a similar kind of risk factors that a smoker would. So they have peers or friends who smoke. They have other risk factors such as elevated mental health symptoms, for example. But even when we control for these factors, there's still an increased risk of smoking among young people. So yeah, it's completely disheartening. We were almost there. And then these devices came on board, and it's kind of tobacco control is suddenly back on the agenda. And we're really sort of backpedaling.
I did do a little bit of reading which seemed to suggest there was some connection between vaping and depression. Is it a case of which came first, chicken or the egg? You're more depressed, so you're more likely to vape, or you're vaping and it's making you depressed? Do we know which one it is?
Look, I think you've hit the nail on the head there. We don't know which one it is first. We know that this is a very strong bidirectional relationship. So young people who have never vaped before but who have elevated symptoms of depression are twice as likely to vape. Young people who are vapers then are twice as likely to develop depressive symptoms over time. So we don't really know. The same relationship, interestingly, exists for regular cigarettes. So people who have mental illness are 2 to 3 times more likely to smoke combustible cigarettes. So whether this relationship is down to the nicotine and the way that nicotine works in the brain, which we can talk about, which is really fascinating, or if it's potentially a self-medicating type behavior. You're feeling stressed, you're feeling depressed, you're feeling like you're not coping. You reach for something that gives you that relaxed buzz, that feeling of just pausing and chilling out, a bit of a mood booster. Maybe it's that relationship. Again, data from the US, that same PATH study that I mentioned, found that relationship was bidirectional. But for young people who were vaping at the start, who didn't display depressive symptoms, as they continued to vape, their depression got worse over time. So there potentially is an effect that is going both ways. The depression might make you more likely to take up a vape for whatever reason that is. But then the vaping behavior over time might be degrading your mental health, potentially because you're using that as your own coping mechanism. The impact that nicotine has on your brain is very short-lived. So you inhale nicotine, it hits your lungs, it goes to your brain within about 10 seconds, and you get this immediate mood boost. It is a stimulant drug. It is an anxiolytic drug. It reduces feelings of anxiety. That disappears very quickly. So you then get this withdrawal effect, and that can be very uncomfortable. So potentially we're seeing an interaction between the reward pathway in the brain and the development of mental disorders. It's a complex situation, and it very much, I suppose, to summarize it really nicely, chicken and the egg. I think there are risk factors in both directions.
So let's talk a little bit more about nicotine and why it seems to be so addictive, and what does it do and what does it do that's bad?
Absolutely. Look, if you were a business owner and you were the person who came up with the drug nicotine, you'd be a multi-bazillion squillionaire. It is the most effective drug that is out there. So as I said, nicotine can be inhaled, it can be absorbed through your skin, and it can also be absorbed through your oral mucosa, so your nose, your mouth. What happens is it hits your lungs, or it enters the bloodstream, and it goes to your brain. And nicotine then acts on these receptors in the brain, these neurotransmitters, which then produce feelings of pleasure. So this is your classic reward pathway. You get a hit of nicotine, it releases all these wonderful neurotransmitters like serotonin and dopamine, and you get this very short-term effect of feeling relaxed, getting a little bit of a stimulant buzz, and also feeling calm, pleasurable. You get this warm, fuzzy kind of sensation. What happens over time is that feeling stops, and then your brain goes, hang on, no, that was really nice. More, please. I want more of that. So your brain changes its structure. It upregulates the number of receptors that it has in the brain in order to kind of attach more nicotine to it. So these are our nicotinic acetylcholine receptors. Not very interesting for most people, but these are very reactive to nicotine. So the number of receptors in the brain increases. So what you need then is more nicotine to fill the number of receptors to get that same feeling. So the first hit of nicotine, people get this incredible response. It's incredibly pleasurable. The brain increases the number of receptors. Then you have your second same amount hit of nicotine, and your brain goes, oh, it was pretty good. Wasn't the best. A bit more, and it will feel better, right? So then you vape twice as much to get that same pleasurable feeling. The brain then responds again and goes, that was so great. Yep, more of that, please. Reinforcing that behavior. So then you need more. You need 3 hits to get that same pleasurable effect. This is the addiction cycle, and it continues on. So it is incredibly reinforcing. Your brain is basically telling you, that thing that you've just given me, I'm going to keep changing my structure so you give me more over time. When you don't have nicotine administration, when you don't have a hit of your vape in that period of time, you get this horrible feeling of withdrawal, right? So say you wake up and you have a hit from your vape every morning. You wake up one morning and you don't have that hit, you are going to feel incredibly irritable. Your brain is seeking out the nicotine. So you'll feel anxious, you'll feel irritable, you might feel a bit nauseated. For people who are very chronic drinkers of coffee or even caffeinated energy drinks or soft drinks, people go through the same level of withdrawal. They feel sick. And what makes you feel better in that scenario is more nicotine. So this withdrawal addiction cycle is incredibly strong for nicotine. So that's one of the things we're really battling. On top of this, the adolescent brain is different to the adult brain. So the adolescent brain is what we call incredibly neuroplastic. Young people are in a period of time neurodevelopmentally where their brain is forming new connections. The prefrontal cortex of the brain, which is rational decision making, being sensible, hasn't fully developed yet. But the base components of the brain, the things that drive our emotion, our sensation seeking, our reward response, is getting quite close to being fully developed. So you have this brain that is seeking out sensation, seeking out pleasurable and thrill-seeking type behaviors, but without that overlaying prefrontal cortex to say, hang on, that's probably not a great idea. So we see this across all adolescent behaviors. They are much more likely to be involved in road traffic accidents because of that sensation seeking, looking for the thrill of speeding, experimenting with substances, doing just silly things that adolescents do, right? When you add nicotine into this mix, it is the perfect storm because the brain is so neuroplastic. That response that I talked about, that upregulation, that increase in nicotinic receptors is even more pronounced in the adolescent brain. So it's no surprise that you're seeing and hearing reports of 15, 16-year-olds saying they are just so hooked. Their brain is wired to hook them on things that make them feel well. And that is just one of the most concerning things here. These products are actively marketed towards young people. The packaging appeals to them. The flavors appeal to them. It's shown on social media. So they're enticed to do it. And then once they try it, it can be very difficult to get off them because they just are so addictive. Yeah, it's it's a real concern.
And so is it big tobacco behind these, or who makes?
Look, that's an interesting question. There is a little bit of misperception in Australia that most of the vapes in Australia are big tobacco. They predominantly are not. They are mostly produced in China. And if anyone has a vape at home, you can actually have a look on the box. I can't remember the exact name of the factory, but it is in Shenzhen, I believe, so the southern part of China. The owner companies of the vape manufacturers in Australia are predominantly independent, kind of entrepreneurial people that live in the US, the UK, live in Australia, who kind of invested in these companies with a view to think, look, this might be a good kind of product to invest in. So it's predominantly not big tobacco. Big tobacco, however, are producing their own types of products that fill the same void in the market. So the European market is a bit different to ours. They have much more of the smokeless tobacco, like snus or tobacco pouches. Your listeners may have heard of Zyns, Z-Y-N. So this is a nicotine pouch that is being produced, and this is predominantly big tobacco. So they are active in the field, obviously, to increase the number of young people in the market. In Australia, it is predominantly separate companies aside from big tobacco, but they are globally, obviously, a player in this space, and they are benefiting from young people entering into and using tobacco products, because ultimately the goal is that then they will be lifelong consumers of, be it cigarettes, be it tobacco pouches, or whatever products they are producing.
And so like how long does a vape last? How much do they cost?
It's really interesting at the moment because we've heard reports that in a convenience store, the price of a single vape used to be around $10, $15, very accessible, very cheap. Now that the border restrictions have come in and the restrictions on every disposable vape is banned, even the non-nicotine ones, the price is more around $50 per vape. So the price is going up. They last, depending on how much you use them, 1 to 2 weeks. If you're a very heavy user, they might only last you, 2 to 3 days. So $10 for something that lasts you 1 to 2 weeks for a 14-year-old, that's pretty affordable. But now that I think people are starting to sense that there may be a little bit less supply out there, we're having reports that the price is definitely going up, which is, it's a good sign. It's the first sign that either supply is reducing or people who are on selling them. So the commercial shop owners or the suppliers are starting to see the risk and are opting out. So there are fewer places where you can get them. So look, they are still incredibly accessible and they're relatively pretty cheap. You got to think again about the tobacco market in Australia. So a packet of cigarettes, 25 cigarettes, which if you're a heavy smoker lasts you 1 day, is now around the $50 to $60 mark in Australia. So relative to cigarettes, they're pretty cheap, but we are starting to see the price go up.
And I have to say, as a GP, I haven't had many patients come in and ask me for prescriptions. Do we know, has there been much uptake in pharmacies for the pharmacy delivered vapes?
There's not. So I am not surprised, Shauna, that you've not had many people come in to do the legitimate thing and ask their GP for a prescription. The reason for that is twofold. The first, it is still very easy to go and get a vape. So seeing a GP and potentially paying out of pocket if you're not bulk billing, organising that, you could easily just, instead of all of that rigmarole, go to your convenience store and get a vape. I should also add that the sale is not just bricks and mortar stores, so not just physical stores, but online as well. So if you go to Marketplace on social media platforms and you type in things like fruit or ice or puffs, vapes tend to come up with no search results because the suppliers know not to label them. And you'll see heaps of listings of, typically there's photos of a fruit platter. And it says, various sizes, flavors available, text me, deliveries included. So we're still seeing a lot of online supply. So we might be seeing supply drying up in the stores where it's becoming a little bit riskier to supply them, but there is still very much online. So the reason people aren't going to GPs is because it's so easy to get them elsewhere. Going through pharmacies, so a pharmacy has to opt in to be a provider of nicotine vapes. These vapes need to meet certain guidelines for safety. Flavors are restricted to tobacco, menthol, or mint. They have to demonstrate that they meet what we call the TGO 110 guidelines for safety. There are just so few vapes that fit the bill, and there are so few pharmacies that have opted in that it's almost non-existent that people are using this prescription therapeutic route. It'll be really interesting to see come the 1st of October what that looks like. But at the moment, look, long story short, it's been so easy to get them elsewhere that people aren't bothering going to their GP, which is unfortunate because you go to your GP, you're not only just there to get a piece of paper, you're there to have a consultation with someone. You're there to have, you can do a little bit of behavioral therapy with them to say, like, talk me through your smoking or talk me through your vaping. When are you finding it most difficult? How about we try cutting out one or two here or there and do a bit of behavioral therapy, which we know is really useful. So it's unfortunate that people are just going straight to convenience stores, but you can understand why, right? It's just so easy and it's relatively cheap still.
If anyone listening is either vaping themselves or has a teenager vaping, what would your advice be? Obviously, apart from maybe stopping, but how would you approach it, and what does the evidence say is the best way to try and stop vaping?
So if you have a young person in your life who is vaping, the first thing is to make them not feel like they're in trouble. I think that is so crucial for any health behavior. If you want to engage someone, particularly a teenager, they don't like to listen or do things. They're developing their own sense of identity. They want to go and do their own thing. But if you can show that they're not in trouble, this is not about a judgment. You're not a bad person. Your brain has clearly developed an addiction to a drug that I can try and help you through. So the first thing would be connect without judgment. We know from the evidence that when we work with year 7, year 8 kids, which is typically where we do our interventions for drug use because they're mature enough but haven't yet started, we know that if we just say to them, don't do drugs, it's not going to work, right? The same with an adult, just don't drink alcohol at all. It's probably not going to work. What we need to do is go in and say, hey, this is how it works in your brain. So nicotine is designed to be addictive. Your adolescent brain is still developing, and I can see you're likely developed an addiction to that. And I want to help you through it. So if you suspect that your young person is addicted to nicotine, there are sort of 3 main questions you can ask them. The one is, do you vape when you're alone? That's often an indicator, if they do, that they are addicted, because vaping is, like other drug use, typically a very social behavior. So if it's just occurring in a social context and not outside of that, they may be dabbling in a substance but not necessarily addicted to it. The second is, how soon after you wake up do you have your first vape? And if it's within half an hour, of waking up, then it is highly likely that they have developed an addiction to vapes. And I like to phrase it as your brain has developed an addiction. It's not you. It's not a personal judgment. This is how the drug works. And the third is, are you waking up to vape, or are you struggling to get through extended periods of time, like being on the bus or being in class, without it? So there are 3 key signs. Are you doing it on your own? Are you waking up and vaping straight away? And are you struggling to get through extended periods of time, like sleep, class, or travel? Walking hand in hand with them, not judging them, and going and listening to their perspective. So tell me about how it makes you feel. Like, what are these things? I'm curious. I want to understand where you're coming from. How does it make you feel? And then if an anchor is provided by the young person, and it's like, look, I'm really struggling. I don't know, like I'm stressed and it's the only thing that makes me feel better. That's your anchor to go, look, hey, I'm here. I can help. What can we do? Why don't we brainstorm this together? What would you like to do instead? What would ideally a morning look like, or an afternoon after school look like without a vape? How can we remove it and then replace it with something else? The other thing is identifying those at-risk periods, and instead of just taking something away. So if someone said to me, okay, Emily, you go to work, we're trying to cut out your caffeine intake, and you get to work and you can just have nothing, I'd be like, well, I'm sorry, that's not going to work. It's not going to cut it. But if someone were to say, look, replace it with something that's much less harmful or much less negative, like have a decaffeinated tea or have nice flavored water on your desk, replacement is better than just total removal. So if you can replace with something else that is going to give you a dopamine hit, it's never going to be the same as a nicotine hit. Very few things are. But if you can replace it with things that are healthy hits, sun in the morning on your face can give you a dopamine hit. Reading a book, chatting with a friend, going for a run, all of these behaviors will give you that same hit. They will also be good for your physical and mental health. So also likely to reduce the risk of development of other mental disorders. For a young person who is very addicted, there is the possibility of using nicotine replacement therapies. So these are over-the-counter therapies you can get even in major supermarket chains. So these are available for anyone who is aged 12 and over. If you do have a young person who is between 12 and 16 and you think they are highly addicted to nicotine and you want to use nicotine replacement therapy, I'd recommend going to a GP first and having that discussion. They don't need to give a prescription, but they can give some advice around use. So these things typically involve putting a nicotine patch on your arm, sometimes 2, depending on the level of addiction, and leaving them there all day. This will give you a baseline level of nicotine that just takes that edge off. So instead of having absolutely nothing and your brain is screaming out for it, you've at least got a steady release of nicotine over the day. I know that gum is not something that most schools allow you to have, but there are other, so you can have lozenges and other what we call adjunct types of nicotine replacement therapies to give you that little micro hit over time. So the nicotine in these devices, in these products rather, have met certain safety standards, so that they are significantly more safe than vapes. And they deliver nicotine in a way that doesn't have the additional harm, like inhaling particles, for example. So that's for someone who is very, very, heavily addicted, and it is an option. I've heard of school support officers having supply of nicotine replacement therapy for kids, for example, who just can't get through class. And that is a very legitimate use of what we call NRT, nicotine replacement therapy. So a combination of behavior therapy, mapping out your day, identifying risk times or even triggers. For adults who smoke, there are very clear triggers. Going to the pub, having a pint of beer, you are much more likely in that period of time to light a cigarette. So identifying your trigger points and trying to replace with something else that gives you a similar hit. So if you come home from school, so it's 3 p.m., and it's prime time, you're getting off the bus and walking home or whatever, that's often a risky time. How can we then slot something in there to replace that behavior? And a lot of young kids love the flavors, right? This is one of the most appealing things about them. They get a cold mouthfeel. the same ingredient in these ice-flavored vapes is what's in toothpaste. So you get, and chewing gum. So you get this kind of like cleansing palate effect. So potentially having like little mints that you can have, or those little chewy ones that also give you a bit of kind of like that oral fixation hit, can be really good ways of replacing that flavor and that refreshing feeling in the mouth. So it's about identifying patterns, connecting with your young person, finding out where they're at, what times of the day are risk factors, and providing alternative coping strategies.
And in terms of if you have someone who is a smoker, do you feel that, smoking, traditional cigarettes, do you feel that really we should not be encouraging vaping as an option to try and stop smoking? Because I know in the UK, they definitely have kind of gone down that route of, even the National Health Service seems to be sort of, I wouldn't say promoting vaping, but certainly offering as an option to help people stop smoking. But it would seem from our conversation that you're just going to really swap one addiction for another rather than stopping an addiction. Is that a fair sort of summary?
Absolutely. Look, this is a really contentious issue. I have not ever seen a topic in substance use that has been this polarizing. I've got colleagues in the UK who were involved in writing up what was then the Public Health England report and recommendations for the use of e-cigarettes. And that's when this 95% safer quote came out. So a very strong statement from the UK Department of Health essentially saying, we advocate for the use of these products because they are 95% safer than smoking. And so the flow-on effect in the UK was that vapes were allowed to be used indoors. They were recommended as a therapeutic option for smokers and very much encouraged as a way to help people quit. In Australia, we have been much more conservative, probably more similar to the US in that we like to regulate things and control things as much as we can. So we have not been that open about recommending them. But they are part of the possibility, kind of like the platter of options that a smoker might have. Definitely not first-line therapy because of the way that nicotine is administered. So for a smoker, I would firstly recommend combination pharmacological treatments and nicotine replacement therapy with behavioral treatment as well. So there are some really great apps and you can chat to your GP or even a pharmacist and talk about other behavioral ways that you can identify your triggers, identify periods of the day which are danger times, and replace that with better coping behaviors. So that would be first-line therapy. For people who have absolutely had no response from using nicotine replacement therapy, from having a patch on, even 2 patches on, only then would I say, look, the harm from continuing smoking is so high that you're better off replacing that with e-cigarettes. That's when I would consider them to be a genuine thing that you would reach for. If you've got someone who is smoking 80 cigarettes a day and they are not responding to anything else, they are much better off using a vape, using an e-cigarette, than they are to continue smoking. So it's kind of like you do a bit of a risk assessment and go, where are we? How have you gone with previous quit attempts? What did you use? Most people quit cold turkey. It's incredibly difficult because we know that the way that nicotine works is that, as soon as you're addicted to it and then you remove it, you feel awful. So going cold turkey is always, more often than not going to result in relapse. So identifying how they've tried to quit in the past. And if they haven't tried kind of like that combination of using NRT and using behavioral therapy, recommend that. And if they're refractory, still not responding to that, then you would consider recommending using a vape just because, they're at the point of the harm spectrum that it's about harm reduction as opposed to, you want to give them the lesser of 2 evils in that instance. So it is kind of a balancing act. Yeah.
And do we know, you might not know this, I'm sorry to put you on the spot, but were smoking rates higher in the UK than they are in Australia? Do you think that could be a possibility of why the UK government have taken a slightly different strategy?
Yeah, so globally, Australia has always had pretty low smoking rates. From memory, the UK were not that much higher. I think the different approach probably comes down predominantly to the experts who were involved at the time and the political landscape at the same time. So we just happen to have, as we always have had, very conservative, very risk-averse government. At the time in the UK, and I think there was a little bit of kind of like cross-involvement there, where a politician was sort of involved in the reporting. I think it was just good timing in that the experts came up with this report and the political landscape was amenable to that at the time. Yes, smoking rates are slightly higher in the UK. They're definitely higher in Europe, much higher in certain countries, Greece, for example, Spain, France. It could be that kind of influence and the perceived relative risk in the UK was kind of lower at that time because, smoking was a little bit higher. And because in Australia we have tried for so long to get smoking rates down, it's almost like our political landscape was like, no, we are not accepting any possible risk to this coming back up again. But it's a really good question, why different jurisdictions have different approaches. New Zealand is the perfect example. Very similar country, geographically, we're right next to each other. But they've come in with a very kind of like loose regulation, and it's largely accepted there, as opposed to here where we've gone very restrictive therapeutic model compared to a consumer model. I think a lot of it comes down to politics.
Yeah, it's I think it's going to be a watch this space kind of thing, isn't it? Because I think it's going to take time for us to really understand, what the health consequences are. I know people talk about this popcorn lung scenario, which I believe dates from a popcorn factory that there was actually some kind of vapor released and all these people got damaged lungs. What's the connection between that and vaping?
So the popcorn lung thing, look, by and large, it's sort of not really a risk anymore. But it was a particular flavour, this is a caramel flavour molecule that is now explicitly on the banned list in Australia that was producing this negative consequence. It's the same kind of effect that we're seeing with large molecules entering the lungs and then you're getting an inflammation type response. So it did exist. It wasn't explicitly due to e-cigarettes. Some e-cigarettes that had that chemical in them, but it was more around the chemicals in the flavour. There are thousands of chemicals in, and there are thousands of different flavours. So it was more concern around, we don't really know what the chemicals are in the flavours, and some of them in particular, so the caramel flavouring, and there was one other that escapes me at the moment, that were at increased risk of lung inflammation. So that's kind of where that came from. We've not really seen it since, predominantly because I think a lot of these flavouring compounds have just been taken out. So they've removed them. Yeah.
And do you know if there's research going on at the minute to see whether certain flavours are worse for your lungs than others?
Absolutely. So there's actually, so you would, your readers, listeners may know that in the US, they tried to bring in certain flavour bans because of the theory that certain flavours were worse than others. By and large, in the Australian market, the flavours that we get are relatively consistent. So I don't know so much here about the difference in flavouring, but definitely in the US market where there's a huge different variety of them, we were seeing absolutely higher rates of lung damage from this caramel flavour. I think the other one might have been cherry, but people have looked into this because some flavours just have more chemicals in them than others.
And are there any concerns that there are other drugs other than nicotine being added into vape?
Absolutely. This is one of the emerging concerns that I think is going to be a big issue in Australia in the coming years. As the ban comes into effect, and the penalties for shop owners for supplying these is, in the millions of dollars in potential jail time, I think we're going to be moving away from the walk along the high street and just grab a vape and more to online markets and what we call dark net marketplaces. So dark net marketplaces have existed for a long time. The Silk Road was a really good example of one. And this is where people get all sorts of horrendous things: illicit drugs, child pornography, weapons, guns, etc. So these are marketplaces that do exist, and people use them to access things that they can't otherwise get. We scraped, so we gathered data from the online marketplaces. This was back in 2020, and we already were starting to see cannabis vapes being available on the dark net at the time. There wasn't such a market just for regular nicotine because it was so easy to get. You wouldn't risk going down the illicit route. But we are starting to see vapes being used as an unintended drug delivery system. So aerosolizing cannabis is one very common example. So putting cannabis oils or CBD into them. Definitely, there was an instance where someone was vaping a cannabis vape and it was contaminated with a nitazene. So nitazines are a type of very strong synthetic opioid that more often than not result in death. So I think we are going to see vapes being used to deliver illicit drugs, predominantly opioids, so things like heroin and its synthetic forms, as well as cannabis. So this is something that I think Australia needs to have its finger on the pulse of, because it will start to increase over the next few years while the illicit market is going to be knocked out.
I did notice a few weeks ago I was in a restaurant and there was clearly people sort of kind of half secretly vaping in the restaurant. Is it illegal to vape in a restaurant or in a public space?
Yes. So anywhere that smoking is banned, vaping is banned as well. This is something that is not so widely known. I think New South Wales Health recently came out, you might see them on buses around the place, that says smoking is banned, that means vaping too. So just as a reminder that people, that the Smoke-Free Tobacco Act, anywhere that smoking is banned, vaping is banned as well. I think a distinction to make here is that if you're a vapor, so we're talking about illegal behaviours, things that are banned, whatever, the punishments are not for the individual. So the concept of the legislation is not to allow a police officer to run up to a 17-year-old and go, hey, I'm going to arrest you because you're vaping. It's around the commercial supply and the manufacture. So it's about the people who are supplying them or who are distributing them in their stores. So it's not about personal punishment. It's more around the commercial side of things. But yeah, if you see someone vaping in a restaurant, it is banned. I think a lot of proprietors, out of pubs and clubs and whatever, are kind of hesitant to go up and say, you can't vape here. Whereas absolutely, imagine if someone lit up a cigarette, it would come with that question. So I think over time that social acceptability will slowly change and people will get used to it. But yeah, there are risks of secondhand vape exposure that are, shouldn't be discounted. So there's a reason why e-cigarettes and vapes are included in exactly the same regulations as smoking. Yeah.
Do we know if there's any connection or risk of causing cancer or other health concerns like that?
Yeah, it is a little bit too short of a time to see cancer. I think the way that the molecules are working on the body, there is definitely a cancer risk. This would mostly be coming from contaminants in the e-liquid, in the vape juice. So I've got a colleague at the University of Wollongong, Dr Jodie Moller, who's just an absolute gun. And she pulls apart these vapes, the ones that have been seized from schools and other places, and then she does testing of what's in them. And more often than not, the carcinogenic compounds are not from the normal ingredients. So nicotine is not carcinogenic, neither is propylene glycol. Most of the flavorings are not. But the metal components, when they're heated, can become quite unstable, and they might leach chemicals into the e-liquid that are carcinogenic. So things like aldehydes, formaldehydes have been detected in vape liquid, and these are known carcinogens. So the possibility definitely does exist, probably to a much lesser extent than tobacco cigarettes, because they're present in much smaller quantities. But absolutely, the potential exists, and it's kind of scary. We haven't had enough time between vapes being on the market and for people to develop cancer to know yet. So this is another thing that people will be tracking, but the potential definitely does exist.
Yeah, absolutely. I want to ask you if you could give people 3 reasons that they should stop vaping now, what would they be? What would be your top 3 reasons?
Probably my top one, because I also work in mental health. The top reason would be you will feel better. Your mental health will be better if you stop vaping. The second is that you will demonstrate to yourself that you can do it. Don't worry about what, politicians are saying or what the rules are. If you can demonstrate to yourself that you can quit vapes, you can basically do anything, right? So you have the ability to do that, and you should do that. And the third is because we just don't know enough about them. Experts around the world are so divided, and we are so uncertain that the safest thing to do is to not vape because of the unknown health harms that we just don't know. So the first is do it for your mental health. The second, do it for your own feeling of self-efficacy and control over behavior. And the third, because of the unknown health harms. It's just too scary. It's too dangerous, given we just don't have the data on it yet.
I have to say, on the whole, the young people that I know, I've got 4 children, but obviously I have lots of contact, both as a doctor and just as a friend. And I think young people nowadays on the whole are so amazing. They're so much more educated. They're often really motivated about their health. They often eat way healthier than you would expect. They're really into exercise. They're often really into their skincare regime and like really looking after themselves. And this just seems sort of really counterintuitive to that direction that everyone has moved in.
Absolutely. There is a whole wellness trend, and it is all for the better. People being aware of their mental health. I had not heard of the term Mentee B until I started working with Gen Z. We work with a lot of young people. They help advise and design our intervention programs, right? So it's not just old fuddy-duddy people sitting down going, what should we put in that? We work with young people, and they are so on the pulse. They know what's in vapes. They know that they're harmful. And it does seem so counterintuitive that amongst all of this wellness, this, insight into their mental health, knowing what's going into their bodies, being aware of chemicals in water, for example, filtering out water, being hydrated, looking after their skin. Everyone's using niacinamide and, retinols and whatever. And then suddenly, but you're also vaping. And I think that is really telling about how influential the social media has been, how desirable these products are to young people, and how addictive nicotine is, that despite all of this kind of wellness and insight into healthy behaviors, that we are still seeing an increase in vaping. So it just demonstrates how addictive they are, how appealing they are, and how hard they are to quit. So it's it's concerning. But what we can do is kind of leverage that philosophy and go, the best thing you can do for your health and your mental health is to not vape. How can we utilize these other things that you're doing, like exercise, like mindfulness, like yoga, etc., to use those to replace the vaping behaviors to keep you as healthy as you can? This is not about adults going, I'd want to control you. This is about us wanting young people to live the best lives that they can.
Absolutely. And just one other group that I'm definitely seeing starting to vape a little bit more, which has been a bit surprising to me, are some women in their 40s and 50s. I don't know whether that's a group that you're aware of. I work a lot with perimenopausal and most postmenopausal women. So I don't know whether it's anxiety or, they're not sleeping or they're just feeling overwhelmed. But it's definitely a group that has sort of surprised me. Some mums that I know have sort of admitted to vaping in secret. So I definitely think it's not just all young people. I definitely think there's some middle-aged people doing it as well.
Yeah, absolutely. And I think, as you say, our understanding of the perimenopause and menopause in general, it's suddenly, there's this period of enlightenment. We're realizing it's a very long period of time that women can be in perimenopause. And the changes in hormones, I think, probably have a lot to do here with seeking out kind of sensations in the same way that an adolescent brain would. So on one hand, it's not surprising, but on the other, it's sort of like, whoa, what's going on here? You've gone through all of this, that it's not good for you, and yet still it's a behavior that you're engaging in. So I think probably better understanding of what's happening in women at that time. It is kind of like the next major point in people's lives where they're having a huge change in hormones and a huge change in their brain. I've heard people describe it as being the second adolescence. So I think it is a risk period. It's something that I guess GPs and other practitioners should be aware of, that it is a period of risk. Alcohol use as well being very common and risky in that age group. It's fascinating. I don't work necessarily among this group, but we need to be across it and I guess understand what the drivers are. Yeah, it's absolutely interesting.
Emily, you have been amazing. You've been so generous with your knowledge and I have learned so much. It's been fantastic. I'm going to ask you one last question, which is something we ask at all of our guests. What is the piece of advice that you would give your 20-something self if you could?
I thought about this long and hard because I feel like there are so many things that I would say to myself. I guess stick to your guns is what I would say. If you don't try to fit in, everyone is different for different reasons. And the difference that you have is what makes you unique. So if you have a strong feeling about something, stick with it. If you see something that's happening that you don't agree with, stand up for it. That's what I would say to my 20-something-year-old self.
I love that. Thank you so much. Thank you very much indeed for coming today.
Awesome. Thank you so much, Shauna, for having me.
When I started this podcast back in December 23, I knew that I was lucky enough to have amazing conversations with various health professionals across all facets of medicine and allied health. And I knew that you would probably really enjoy being a fly on the wall to hear what we talked about. And that's how the podcast was born. And what you probably don't know is that this is a bit of a passion project. We don't have any sponsors or funding. And without your help, we won't be able to continue bringing you these great guests. So if you can please spread the word about the podcast, share it with someone who you think might benefit from the conversation that you've just listened to. Or if you can leave us a review or a comment, it would mean the absolute world because that actually helps the podcast spread further and get more people to hear our message and hopefully allow us to invite bigger and bigger guests onto the show. And I would so appreciate you helping me back. Thank you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.